First signs of a fatty liver. Located on the upper right side of the abdomen, the liver is the largest internal organ of the human body. The primary functions of the liver are to process food nutrients and remove toxins. Before going to other parts of the body, blood from the digestive system has to be filtered through the liver first. Hi, this is Wirlo, and welcome to Health Shadow. Today, we're going to look at the first signs of a fatty liver. But before we begin, make sure that you have subscribed to the channel. Also, hit the bell icon to get the latest updates of our videos. Fatty liver is a condition when fat accumulates in or around the liver. It is known to cause numerous complications. Scientifically, it is termed as steatosis, which is the accumulation of excess fats in liver. There are various factors which can result in storing of fats inside the liver. Fatty liver disease is a common liver illness, especially in Western countries. 1 out of every 10 people suffers from this. It is normal for the liver to contain a specific amount of fat, but if it accounts for more than 10% of the liver's weight, then there is a high chance of having fatty liver, or steatosis. The disease is likely to get worse in time as more fat is stored in liver cells. Fatty liver might not cause any harm, but at times the excess fat leads to inflammation of the liver. This condition is known as steatohepatitis, and it even causes liver damage. Sometimes, alcohol abuse can also result in inflammation of a fatty liver. Certain metabolic processes in the liver are altered due to heavy alcohol consumption. More often than not, fatty acids combine with these metabolic products. It eventually leads to the formation of types of fat that can accumulate in the liver. When this happens, the condition is known as alcoholic steatohepatitis. When the liver gets excessively fat due to other reasons than alcohol consumption, the condition is called non-alcoholic steatohepatitis or NASH. The cause of fatty liver disease is less clear in people who don't drink a lot of alcohol. There are 2 possibilities considered for this. One, that there is too much fat in the body, having fatty liver, and the second, that fat is not metabolizing at the normal body rate. Over time, an inflamed liver may become hardened and scarred. If it comes to that, the condition becomes serious and often results in liver failure. This is the most severe form of fatty liver disease, which is called cirrhosis. Non-alcoholic steatohepatitis is one of the top 3 causes which lead to cirrhosis. Progress of a fatty liver can be divided into 4 stages. First, harmless fatty liver. It is the initial stage of fatty liver in which excess fat is built up and stored in the liver. Simple fatty liver is harmless in general, given that the amount of fat stored doesn't increase. Second, steatohepatitis. Second stage is steatohepatitis, during which, along with excess fat, there's also inflammation in the liver. Third, fibrosis. When the liver stays persistently inflamed, the condition worsens and causes scarring. This worsened form of steatohepatitis is known as fibrosis. It causes numerous effects, but the liver can still manage to function. Fourth, cirrhosis. When scarring of the liver becomes widespread, it impairs the liver's ability to function and is known as cirrhosis. It is the most severe stage of fatty liver. Cirrhosis is an irreversible disease. Causes: 1 or more factors like obesity, type 2 diabetes, insulin resistance, and high levels of fats in blood may play a role in people who don't consume much alcohol and develop fatty liver disease. There are some other potential causes of fatty liver, which include certain rare genetic conditions, side effects from some types of medications, and even infections such as hepatitis C. Symptoms. Moving on to the symptoms of fatty liver, 2 basic conditions, AFLD and NAFLD, have the same type of symptoms. Although, in some cases, fatty liver has no noticeable symptoms, but the few cases which showed symptoms of fatty liver included feeling tired almost all the time. Another indication is the pain in the upper right side of the abdomen, exactly where the liver is located. Some people with fatty liver disease develop complications, including liver scarring, fibrosis, and cirrhosis. As now you know that the liver damage due to cirrhosis is permanent, and that's why it's so important to prevent this condition from developing in the first place. In most cases, these warning signs of fatty liver, which is hepatic steatosis, are asymptomatic. What that means is, until a person is tested specifically for the condition, it is difficult to detect. Blood tests, liver biopsies, and liver ultrasounds are some of the tests which are useful in diagnosing this disease. So you see, there are no specific set of symptoms which warn about fatty liver. Nonetheless, it should be noted that a few patients do experience symptoms and certain health problems, which can be related to fatty liver. Let us go through the first signs of fatty liver. Number 1. Fatigue. The lack of energy and constant fatigue, as the liver cannot function properly, is one of the possible warning signs of fatty liver. An unexplained tiredness appears as a result of the slow metabolism. When this happens, among other symptoms, it is possible to have concentration problems as one feels confused. Number 2. Abdominal bloating. According to some cases, abdominal bloating is another possible warning sign of fatty liver. It is when the abdominal swells. The conditions are typically known as ascites. It is usually a consequence of liver disease and consists of fluids between a visceral and parietal peritonia. Difficulty breathing, abdominal distension, indigestion, and pain in the back are the common symptoms of ascites. Number 3. Abdominal pain. One of the warning signs of fatty liver is abdominal pain, as some patients have experienced it. If it is the one that you have, it might be due to some other reasons, but if it occurs together with other annoyances, then there is a chance of fatty liver. Generally, it is felt in the middle or upper right part of the abdomen, and it does not even have to do with any activity. It can occur every time you take a meal. As the stomach expands, it presses on the enlarged liver, causing intense pain. Number 4. Skin changes. Another first sign of fatty liver has to do with changes in the skin. The appearance of jaundice is the most significant difference in the skin when there is a fatty liver accumulated in the tissues. Due to the increase in the levels of bilirubin, this yellow coloration starts to appear on the skin and mucous membranes. Due to fatty liver, some other skin changes also begin to show, including fragile capillaries, unusual colors around the neck and armpits. White spots can also form under the nails. When someone is diagnosed with a fatty liver, they should immediately begin proper treatment. Along with medications prescribed by the doctor, it is vital to have a proper, low-fat diet. Number 5. Dark urine. There are a number of ailments and diseases which can be detected by urine. It is due to the reason that this liquid contains toxins and waste. If one is suffering from the condition of fatty liver, the urine will be a darker color than normal. In addition, their stools will also have an unusual color. Recommendations. If you experience any of these symptoms, make sure to visit a doctor at the earliest and get tested. Still, it is best to stop fatty liver in its initial stages. The following recommendations will help reduce these conditions. Avoid alcohol at all costs, as it is one of the main enemies of the liver. The excess consumption of alcoholic beverages increases the accumulation of fatty liver condition to the disease of steatosis and cirrhosis. A Mediterranean diet is best for patients with fatty liver. It is considered as one of the healthiest diets in the world and is based on many foods that are low in fat and foods which have healthy fats. Stop your intake of refined products, flavors, and white sugars. Instead, try to opt for more grains and similar ingredients. Don't take medications on your own. Check with your doctor and find out which drugs can be harmful in case of a fatty liver. Participate in sports and have regular exercise. Burning of fat helps the liver system work properly. At least 3 times a week is advisable to practice these routines. Although rest is necessary, exercising a little each day will help you excel the recovery process as well as to promote the health of the rest of your body. Thus, carry on with your daily walk or stretching sessions and stay healthy. Thus brings us to the end of our video. I hope this is helpful for you. Leave your suggestions and comments below the video. See you next time.